Hello everyone, so let's grab yet another MRI scan from the queue and see what we can have fun with. So let's see, this is a female patient, 59 years old. I just hit download, it's downloading images. So I'm going to see here what is the clinical history. No, nothing obvious here. So she is, it says she has lung cancer and this is staging. So I suppose she has some kind of neurological symptom related to this quest for this search for, which justifies the search for some kind of brain lesion, I suppose. And she has a CT scan from April of this year, which is normal. So no CT scan, no signs of secondary disease on the CT scan back in April of this year. So the images are here. I'm just going to share my screen so you guys can see. Yep, this is a very bad exam, very poorly done. This is just by looking at this is very low quality. I hope we can actually make something out of it. I doubt it, but let's see. It is a sagittal T1. Oh, the patient has a lot of metal tooth related material. So this is dentistry material, which is metallic, and there is a huge, very big, very massive susceptibility artifact coming from here. So these are probably teeth implants, metallic teeth implants. And we can't, there is, I'm so sorry. There is some trouble right here, and at least right over here. This is some serious business, guys. Yeah, this is secondary disease for sure. So brain, this is a flare. Flare is a T2 with a inversion recovery pulse. That anything that goes bright is disease. Liquid, brain liquid is black, and anything else that shows up is supposed to be pathological, and it is. This is clearly something right here, a major lesion here, another one here, and a bunch of other bright spots all over the brain. This is going to be very serious. Right there. So let's grab a T2. This is an axial T2. All seek to suffer from the artifacts and are distorted and darkened, and we lose a bunch of signs and sensibility to detect small lesions, especially on the posterior fossa right there and on the base of the skull. This is just what it is. We can't really help it, but we can tell this is advanced secondary disease, metastatic disease for sure. Let's just see how we can, just like that. This is a lesion. This is yet another lesion on the thalamus and the basal ganglia. There is probably a lesion right here. I hope they have done contrast enhancement. Yeah, there is contrast. There is terrible contrast enhancement, but it is there, so we may just be able to use it. So I guess this is all secondary disease, bilateral diffuse massive secondary disease. Whatever symptoms this patient's having is presenting, it's very much justified by this finding. So diffusion weighted images are very prone to any kind of artifacts, and this is of course a mostly useless sequence due to those artifacts, but now we can see there isn't much sign of restricted diffusion. Usually metastatic disease is like that. This is a susceptibility gradient echo for calcification and blood products. The metastatic lesions don't seem to have bled yet, so there is no blood product. Signs of degraded blood products on the brain lesions. This is fine. Nonetheless, we have to face this terrible, horrible post-contrast sequence. This is very bad. See how bad this is. This is probably volumetric 3D sagittal gradient echo images. It's really prone to susceptibility artifacts, and it's almost half of it is completely destroyed by these artifacts that come from the teeth. But we can see that lesion is solid. Let's just do an MPR and get ourselves more info. So it's really bad, doesn't even saturate, goes all black. We can window it a bit, but it's really distorted. We can't do much about the posterior fossa, but we can see here that big lesion right there. That is 2.3. There is yet another right here on the temporal lobe. That is 0.8. Let's see. Yep. Oh, enhancing right there. Kind of enhancing right there. Just as we saw in right there on the occipital lobe on the right. Yeah, 0.8 also, maybe a little less, 0.7. And this is it. Oh, right there. Occipital lobe also there. See? This is another secondary intraaxial lesion. So there are a lot of secondary lesions with massive edema and all this this mass effect on the parenchyma. We can compare one sequence to the other. So this is occipital, right there, temporal, thalamic, frontal and parietal lobes also are affected by smaller secondary tumors. So this is all metastatic disease from the lung cancer. So all we have here is what is left for us to do is report this. So the brain itself has normal size and volume. The ventricular system has a normal size also. Brainstem and cerebellum look fine. We just have to report that massive artifacts and its consequences to the quality of the exam, and report each and every lesion, or at least the lesions in a whole, so the doctor can take action considering this massive advanced secondary disease. So let's grab a template. I have a template for this. I'll start off with a normal template, contrast enhanced normal template. I'll take off the phrase that says there is no anomalous enhancement, because there is. And I'm going to describe the lesions. They are bright on flare, T2, and they are of low intensity, low signal intensity on T1, no restricted diffusion, nor signs of old blood, and they heterogeneously enhanced due to the presence of gadolinium. So let's do that. They are intraaxial, meaning they are inside the parenchyma, they are not exterior to the parenchyma on the subarachnoid space or the extradural space. The larger one is 2.3 centimeters. So they are all over the place. And we are done. If you like this video, I'm pretty sure you're gonna enjoy this one right here. Just click here to keep watching, hit that like button, and consider subscribing to the channel. And until next time, I'll see you around. So long.